Case 18. A 36-year-old homeless man presents to a community health clinic complaining of increasing shortness of breath. On questioning, the man admits to an extensive history of alcoholism. A review of systems reveals he also experienced tingling and burning in his legs for the past several weeks. Physical examination reveals that he is tachycardic, heart rate of 122 beats per minute, has rales bilaterally, and has bilateral pitting edema. He also has decreased sensation in his feet and is hyporeflexive in his lower extremities. An X-ray of the chest shows an enlarged cardiac silhouette and bilateral pulmonary congestion. What is the most likely diagnosis? Vitamin B1 deficiency or thiamine deficiency. Although the patient's alcoholism presents a clear etiology, arsenic poisoning blocks thiamine utilization and can result in a clinical picture resembling thiamine deficiency. It should also be considered. What clinical manifestations are commonly present in this condition? This patient has the symptoms of both wet and dry beriberi. Patients with wet beriberi present with high output congestive heart failure and dilated cardiomyopathy. Patients with dry beriberi present with peripheral neuropathy consisting of muscular atrophy and diminished sensation and reflexes. Dry beriberi presents similarly to vitamin B12 deficiency. However, B12 deficiency is usually due to a malabsorptive process, does not cause congestive heart failure, and will cause a macrocytic anemia. The deficient factor in this condition is a cofactor for which enzymes? Thiamine is part of thiamine pyrophosphate, or TPP. TPP acts as a cofactor for transketolase, an enzyme in the hexose monophosphate shunt. Pyruvate decarboxylase, a component of the pyruvate dehydrogenase complex, and alpha-ketoglutarate decarboxylase, a component of the alpha-ketoglutarate dehydrogenase complex. What other pathologies are commonly seen with this vitamin deficiency? Wernecke encephalopathy is the central nervous system manifestation of thiamine deficiency. This disease classically consists of nystagmus, ophthalmoplegia, and cerebellar ataxia. When the additional symptoms of confusion, psychosis, and confabulation are seen, the disease is known as Wernecke-Korsakoff syndrome. It is standard practice to give thiamine before glucose to any patient with suspected thiamine deficiency to prevent Wernecke-Korsakoff. What is the most likely MRI findings? Although degenerative changes are often seen in the cerebellum, brainstem, and diencephalon, atrophy of the mammillary bodies is most commonly noticed.